I was hiding it from my 6-year-old. She came up to me, she goes, "Mom," and I said, "You're not supposed to be in here." She goes, "Well, what are you doing?" And I told her, "I'm giving myself a shot." And she goes, "Why?" And I told her I was diabetic. And then she goes, "What's diabetic?" I explained it to her. She goes, "Oh." And I told her when we go out and eat, we have to eat this much, and we have to eat a lot of vegetables, and we have to exercise a lot. So, and then she goes, "So I won't grow up and take shots too?" And he goes, "Yeah."
Here on the northern part of the Navajo Nation, on the reservation, the folks that live out here, they live on dirt roads. A good portion of these people, about 50% of our demographics, have either no running water, central source of heat, or electricity, or some combination of all three. And as such, it's hard to store fresh food if they don't have electricity. They'll often drink soda pops instead of water if they don't have running water. They have to haul water every week. And so our goal with this clinical pharmacy program is to help these patients have a resource to come into to talk about their medications, talk about their lifestyle, have somebody order labs for them. And from that, we have seen lower A1C rates. We've lowered some obesity rates.
We're not just sending them home with some diabetes meds that the guidelines say are okay, but we've looked at our patient situation. We've looked at their home, their work, their family, their travel situations, what are their eating habits, and we've decided this combination of drugs makes the most sense to keep you safe and make you successful at treating your condition. From what I've seen, my interactions with patients, the level of trust goes through the roof because they feel like, yeah, they really are on my side. It's not just an industrial machine, it's not just an assembly line where I go through and they check my blood pressure and they look in my throat. But they're people who care about my situation. We'll work on getting the drug they need.
There's this doctor, he's a pharmacist in Montezuma Creek. He showed me how to take control of my life. So I took his advice and, no more medication, just that one. It's like a pen that you give yourself a shot. And that's been helping to this day. It really helped me a lot.
When I get up in the morning, the first thing I do is take my blood pressure. That's the first thing I do after I get out of bed. And then I take my pulse ox, but sometimes my fingers are so cold that I have to go warm them up with some warm water before I can get a true reading on pulse ox. And then my normal routine is brush your teeth and whatever, and then I weigh. Try to weigh with my clothes off because you weigh less. So rewarding to know that somebody is looking after you that's not right there in the home with you.
This rural setting has particular issues. We have no public transportation, so transportation is an issue for us. How do we get folks here? And one of the things I hear constantly from my medical providers and medical staff is, I may not see them again for another 6 months to a year, so that's why that visit is longer. I need to make sure that what they're doing is the right thing, and that's a burden on the system too, because then really what should be a 20-minute visit ends up turning into a 45-minute visit, and we do blood work and we do all the things we do because we're anxious we're not going to get them back.
What telehealth does by putting that in the home is that it gives you the information that you have most wanted to know about your patients but really had no way to retrieve. It lets you know what their blood pressures are doing every day. It lets you know what their blood sugars are doing every day, what their weight is doing. And not only that, but because you have the nurse backing that up, it gives you the actual information about what they ate that made that happen, or they had to go visit so-and-so in the hospital every day, and so that's why maybe they haven't been on their medicines for a couple of days and their blood pressure has shot up. All that stuff that 3 months afterwards we're trying to piece together with the patient why certain things might have happened, you have in real time what happened with that.
It makes me feel great that they can monitor him from home because I'm not here all the time, and if his numbers are wrong, whether it's his weight or his blood pressure, they can give me a call, and then we can see what needs to be done, whether he needs to go in for a visit or go to the emergency room.
Healthcare systems fail when people end up in the hospital, when they end up with other complications. We're trying to avoid that by working with providers who are really taking a holistic approach to healthcare and focused on wellness.
We've been able to achieve a pattern of approximately 75% reduction in hospital admissions, readmissions, and emergency room visits for the patients who used remote patient monitoring as part of their chronic disease management. By BD saying, okay, here's some money. We see what you're doing is really going well and you've done the work ahead of time. Here's how we want to make this instrumental. Here's how we want to give value to what you've already done, add more value to it so that maybe that can even grow into a bigger resource for you and for the communities and spread that out even farther and have that ripple effect.
There are so many wonderful community health centers out there that are providing excellent care and have innovative programs, but they don't have the means to really sustain them. And so the support provided by BD and Direct Relief is greatly appreciated and it really is changing lives.